Hi, everyone. Thank you so much for joining us and welcome. I'd like to start by acknowledging the traditional custodians of the lands where you're all watching from. I am calling from Sydney, Australia, so I'll pay my respects to the Gadigal people of the Eora Nation, current and emerging leaders, and acknowledge their ongoing connection to land and country. My name is Yakubu, and I'll be your host for this Tea with Africa series. I was born in Nigeria, so maybe that qualifies me to be your host as one with African ancestry. I spent about 14 years in primary care as a primary care practitioner before moving to Australia in 2019 for my PhD. I recently submitted my thesis, and I currently co-lead an initiative at the George Institute that is aimed at fostering partnerships with African researchers, institutions, and communities. I'm also a research fellow with the George Institute's Gunamana Hill Aboriginal and Torres Strait Islander Health Program and the Center for Health Systems Science. I'm really passionate about today's topic, really regarding equitable research partnerships. And a lot of my research interest is in governance systems at the intersection of health equity and social justice. So I'd like to tell you a bit about the George Institute. It's a leading independent global medical research institute with major centers in Australia, China, India, and the UK. And we really have an international network of experts and collaborators. And our mission is to improve the health of millions of people worldwide, particularly those living in disadvantaged circumstances. And we do this by constantly challenging the status quo, using innovative approaches to prevent and treat non-communicable diseases and prevent injury. Researchers at the George Institute are constantly seeking to establish authentic and long-lasting connections with institutions and academics that work in Africa, and perhaps that will come through in today's session. So please let us know in the chat section if you wish to partner with us, and we really hope that this will be as engaging as it can be. Recently, we've really been paying a lot of attention to the global discourse on health equity at the George Institute. Two publications which I might pop in the chat soon enough. One was published in the Health Policy and Planning Journal titled How to Embed Equity in the Conduct of Health Research, Lessons from Piloting the Equity Tool, and by Misimi Kakoti et al. And the second was published in the British Medical Journal titled How to Ensure Equitable Research Partnerships in Global Health, and it was led by Madhuri Dutta. There's also a group at the George Institute examining how to incorporate justice, equity, and dignity in our operations and the way we do research, and soon enough we will have a health equity colloquium. So there's really a lot of discourse for us at the George Institute, as we also recognize the global importance of this topic. So what are we trying to do with a Tea with Africa series? And I know there might be questions about why the title Tea with Africa. We have actually termed this series Tea with Africa because we want people to think of a relaxed atmosphere to engage with diverse voices and scholarships from African countries. So we're actually recognizing the diversity on the continent. And even with so much diversity on the continent, there's an essence that unites Africans. You just can't put a hand on it, but there's just that thing that unites us. And it's that essence that we call Africa. So when I use the term Africa as one with African ancestry, I'm thinking of that one that nourishes. And some of you might be familiar with the term Mother Africa and Mother of Mankind. So I'm probably not using it in the traditional sense in which the colonial legacy has sort of made it to be or to sound, but more in that sense of that represents the cradle of humanity. So if you can imagine that you've been invited to engage with the cradle of humankind, perhaps you will come to this session with that sense of curiosity, seeking to learn more about pragmatic and culturally sensitive approaches to establishing and maintaining equitable global health partnerships with African researchers, institutions, and communities. So we will be hearing from the panelists, and I assure you they're two talented, skilled, experienced people that I've been looking forward to speaking to and engaging with. They reflect a lot that I would want to be like when I grow up, I say. But I think what I really like about both of them is the humility. I remember Julie saying, hey, you have to make them remember that I can speak for the whole of Africa, and I'm not an expert on African affairs, and I like that humility. And I think that there is a lot, to learn from someone who perhaps does not identify as African by ancestry, but maybe by heart, Julie. And then Andrea, you as someone who has an African ancestry, a heritage, but has also traversed a lot through the globe and within the region. But I also want to, invite people. This is not an exclusive discourse. I would like to invite you to please share your experiences in the chat section. There's a Q&A section as well if you have specific issues you will want the panelists to respond to. But please tell us where you are listening to us from, and tell us about your own part of the world and what your own experiences has been. I'm sure there will be transferable lessons to other parts of the world. So let me introduce our panelists. Professor Andre Pascal Kegner is a medical doctor and is an internist from the School of Medicine of Yaoundé in Cameroon. He holds a PhD in medicine from the Sydney University, Australia. He's the current director of the South African Medical Research Council's Non-Communicable Diseases Research Unit. He also holds a conjoint appointment as professor at the Department of Medicine and the University of Cape Town, South Africa. His areas of research include chronic diseases, epidemiology and prevention, decision-making in diabetes and cardiovascular disease care. He has a background and expertise in longitudinal studies, methodologies, both interventional and observational, as well as related statistical methods. He has practiced medicine, he lectures, he mentors, he conducts research on issues related to chronic disease across many African countries and beyond. He's co-authored over 450 peer-reviewed articles, book chapters, and monographs on chronic diseases, and has received several distinctions during his career as a researcher and as an international expert. Professor Christina Stefan was supposed to be our second panelist, but is unable to make it, so she sent her apologies. But Professor Julie Berlin is here with us. She is the chair of Health Systems and Global Change at Canterbury Christ Church University at the UK. In the UK, she's also a visiting professor at Manmohan Memorial Institute of Health Sciences, Nepal, and an honorary senior research fellow at the Medical Research Council Unit, the Gambia, and at the London School of Hygiene and Tropical Medicine. Julie is an interdisciplinary research leader with 20 years of experience in the field of global public health. Her work spans across multiple areas, including health system strengthening for the control and elimination of poverty-related diseases, health systems resilience to disasters and emergencies, including pandemics, and health system responsiveness to neglected and stigmatized reproductive health issues. Julie works closely with multiple academic and non-academic partners in selected settings across Asian and African countries. In particular, she's worked in China, in Nepal, Ghana, and the Gambia. She currently leads an award-winning multi-stakeholder network on fertility care in countries that we would describe as Spain in the global south, and several other projects. And with her research and collaborations, Julie aims to transform health services through a systems approach, especially among underserved populations. She has an extensive experience in teaching, supervision, and a passion for professional development and capacity building. She holds a BSc in Hons in biology from the Imperial College in the UK, and a PhD in public health and epidemiology from the University of Queensland, Australia. So thank you, Julie and Andre Pascal for joining us. And once again, thanks to everyone who has made our time to come online, and to those who will be listening to this, the recording after. So today we're asking the question really, how do we ensure equitable global health partnerships with African researchers, institutions, and communities. And I might just, invite each of you to share a bit from your experience about, what example stands out for you regarding what you will see as being an equitable global health research partnership that you were involved in an African context. We want to start from, things from a strength perspective and see, just sort of glean from what worked from your own experiences. And maybe who wants to go first? Julie?
Me? Yeah, sure. I'm happy to go first. Thank you. Thanks very much. So I would just like to start really by expressing my thanks to the organizers of this great event for inviting me to speak here. And I think it's a very important topic and also one that's very close to my heart. So I'm really, really pleased to see this topic being discussed today. And like was mentioned, I was initially a little bit hesitant about attending and, taking a space of an African researcher who could actually tell us about their needs and direct experiences in this area, actually much better than I can. But as I was assured that that you also wanted a sort of northern perspective, so to say, having worked, as you said, many years with African colleagues. So I consulted my research partners and so here I am. So I'm very happy to be here. Thank you. And what I'll share with you today is really a combination of my views based on 2 decades of collaborative research and partnership building across several African and non-African countries, and the views shared with me by my partners in 2 large ongoing projects, which I'll mention more about in a moment. But I'm also here as an opportunity to reflect on my own practices and on those, of the partnerships that I'm a part of, a member of, and to learn from others, both speakers but also members of the audience later on, because there are many ways that other people might be doing things, perhaps differently to what we're doing. So it's really with that sense of curiosity that you mentioned earlier, Jacob, that I'm here and approaching today's event. So I have been reflecting on, as you say, some projects or partnerships that I've been a part of that I think have this sense of equitable partnership. And 2 partnerships in particular stand out. I'm not sure if I'll have a chance to talk about both of them, but at least I'll mention one and perhaps come to the other one a little bit later. But both of these partnerships really have equity, at the foundation, or really the core of what we're trying to do. And, we're working on this. So I say working on because I think equitable partnership building is not, a box that's ticked once and then forgotten about. It's a continuous process that we're kind of constantly navigating in a shared and dynamic way, and we're trying to learn and adapt together. So what this looks like in practice is a lot of dialogue, a focus on the people and their needs and trying to distinguish their needs from their wants, managing resources and navigating conflict in respectful ways, and listening, especially listening to those who are less represented at the table or who might frequently be spoken for by others. So one of the projects I want to mention is the NIHR Digital Diagnostics for African Health Systems Research Group and wider network that I'm part of. And this was formed as a network initially in April 2020. So a very difficult time to be starting up a global health partnership. And last year, a research group was also launched within the wider network. The group has two joint leads, Professor Aubrey Cunnington from Imperial College London and Professor Halidou Tinto from the Institut de Recherche en Sciences de la Santé, excuse my accent, in Burkina Faso. In a moment, because it's difficult to multitask, but in a moment I will share the link to the website for that research group in case members of the audience would like to find out more about our work. And the other one that sprung to mind is an interdisciplinary network on fertility care that I launched together with colleagues, Dr. Suzanne Dierix and many other wonderful colleagues across 18 different countries, many of which are in sub-Saharan Africa. And this network was launched 2 years ago and is funded by the White Rose Collaboration Fund. So those are the two sort of partnerships that came to mind in terms of equitable partnerships. I don't know if how much sort of detail you'd want about the actual research, or if I should speak more about how we sort of work together, or whether that's just for the moment to introduce the two partnerships. Please let me know if I should go into more details.
Yeah, thanks, Julie. Maybe you want to sort of pick on one and just sort of briefly tell us what stood out for you for that particular one.
Sure, I can do that. So in that case, I'll go with the Digital Diagnostics for Africa group. And like I said, setting up any global partnership during COVID times had, its fair share of challenges. It was difficult, but I think we managed to do a really good job. And as you say, let's start with the positives. So one of the things, like I already mentioned, is the group has two joint leads, one from the UK and one from Africa. And I think that's been really helpful, because that right from the start sets the scene that this is a shared shared venture, shared piece of work, and all the way from the top, to the bottom. I mean, it's quite a flat group anyway, but in terms of the organization. But so we have leadership from both countries throughout. One of the things that we have really tried to do with this group is to encourage. So we had 10 PhD studentships in the group, and we've made sure that those have gone to African researchers. So in a sense, and I think we'll talk more about capacity building later. When I say capacity building, I don't want people to hear, people from the north or west going to Africa and telling people how to do things. No, that's not at all what we mean by capacity building, but building capacity from the inside up by training and giving opportunities for training to African researchers. So that's one of the things that we've managed to do with that group. And we've also really tried to take into account gender, because I think that's one of the really important things that I hope we'll have a chance to talk about today as well, because gender, as we know in research, it can be quite, and I'm really pleased to see a very nice gender dynamic here. So thank you for inviting me as well as a female today. It can be very difficult for our female colleagues, particularly, across multiple countries on the continent. So we have tried to also encourage female African researchers to work, to join our group and also to be a part of this group. So that's just a very minor thing. I mean, I could probably talk for quite a long time. I know we only have a couple of minutes, so it's quite difficult to pick out a few things. So I'll just give a few flavors really, and maybe we can go into more details later. One of the other things that we really encourage and pay a lot of attention to in the group is community engagement. So how we engage communities with our research. We think that's really, really important, so that research doesn't sit, separate from the communities who eventually should, ultimately should be the beneficiaries and the users of research. So community engagement is something that runs throughout the group, and engaging in as you say, in an equitable way by listening to people's ideas and trying to understand their needs, all the way from when we set the research, when we're designing the research, trying to understand, is this a priority for people in the different countries that we're working in? If not, then we should be doing research that is a priority to people in the countries that we are all working in and collaborating with. So having that kind of right from the start, having that community engagement and stakeholder engagement is really, really important. That, I think, enables people to have ownership and feel empowered about the research that is taking place. So I think that's another thing that's very, very important, to make sure that there is shared ownership of the research, and throughout the entire research cycle. So right from the start, as I said, but all the way through to the methods, design, implementation, publishing. I think we'll talk later probably more about publishing practices, and making sure that colleagues who have been leading the research on the ground are also part of and also leading in the publication and the writing strategies, and being recognized for that through authorship and through different means like that. So those are just a couple of things. I mean, I can go into a bit more detail if needed. Obviously, yeah, I mean, should I, perhaps I'll stop there and then come back to some of those things in a moment.
Thanks, Julia. I think that's a great start, and just really taking in some of the things you've said about not just being just ticking the box, but I like how you capture it as a dynamic process that is adaptive, and that you learn from. And it's not very often that it's been described that way. It just seems like sometimes when you start a partnership, and it's like, oh, it's met the criteria for equity and let's go on. But I'm realizing, again, and just reflecting on what you have said, that yes, it is a dynamic process. Not two partnerships are the same, and maybe you would have a chance to tell us some of the differences and some of the trends that you have noted. But Andre Pascal, if I come to you, you've been, in a sense, in the trenches, and often people say equitable research partnerships, and we don't pay enough attention to what this means on the ground. And maybe you're able to share more examples, in addition to what Julie has shared, from maybe one, and just highlighting what for you, stuck out as being, an equitable partnership in an African context. Yeah. Thank you.
I mean, thank you so much, Jacobo, for your kind words, and also for the opportunity of appearing on this important program today, with also my appreciation to the fellow colleague who join us online. I mean, I thought today what I should reflect upon, it will be maybe a data pooling approach to research on chronic disease in Africa. While I'll be focusing more on chronic kidney disease, I think I'll also a bit be touching on the application of the same approach to other risk factors for chronic disease. But before getting into the core of the matter, I think the pathway leading to those initiatives is also very important. And I think everything would have started in Sydney nearly 20 years ago. I think time is flying so quickly. Where I did my PhD, and part of it used this, this study called Asia Pacific Cohort Studies collaboration, which is a collaborative meta-analysis of cohort study conducted in Asia, Australia, and New Zealand, with over 600,000 participants and some cohort having up to 20 years of follow-up. And that's really where I started having interest in actually using the data pooling approach to research. So subsequently, through connection established in Australia, I was involved in study using the Health Survey of England, and that's actually where I really had a practical knowledge of that sort of approach, and also subsequently the Pan-European EPIC Interact cohort, which is always 500,000 participants. So meaning, when I returned to Africa in 2011, I already had this strong desire of possibly using data pooling approach to research in Africa, but I had no practical experience of using the approach, setting up the approach in Africa at all. But I was so fortunate in the sense that by the time I was coming back, this also other initiative was starting, the NCD Risk Factors Collaboration, which is led by Majid Ezati from Imperial College in London. So it's a very large global collaboration, and I was invited to join this collaboration initially to contribute data because I think they identify some of the studies we conducted in South Africa and Cameroon as potentially eligible for that collaboration. So that's how I joined that collaboration. But I think Majid also, it's a very impressive person, very open-minded. I'll actually allow those who join the collaboration to be able to try things. And that's actually how I was allowed to start an African chapter within the NCD risk, really giving me that practical experience of maybe running in the Africa setting a data pooling approach to research. Although I was not the frontline person because the data was collected by Imperial, but at least I was within that actually tried experience of actually bringing together African colleagues around joint initiative. So I think equipped now with the knowledge from being involved in NCDs, I think I had the desires to just grow further in terms of setting up our own initiative in Africa, and identify chronic disease as an under research area, and I think that identifying as possible a possible way to start. And by coincidence, actually, one of my mentors from Australia, Mark Woodward, who by then was based in UK, had the same idea. So in some way, the two of us were progressing the idea in parallel without realizing, until we spoke to each other and realized actually we were eventually pursuing the same objective. And it was natural actually to think of actually joining the effort. And that's actually how we were able to form the core of research to eventually drive that initiative. Added to Mark and myself, a colleague from UCT, a Prof. Okpeshi, who is now in Canada, and importantly, and not the least, by then, Dr. Cindy, I hope she's online, who had just joined the unit and was junior scientist around that time. So we then positioned her as a person to eventually lead this initiative on our behalf and under our guidance. And an important thing is that actually we're actually starting this research in an area in which we're already present. And I think that was a catalyst. In the sense that before even thinking of approaching colleagues to contribute their data to the initiative, we had our own core data, because across the project we're involved in, both in Cameroon and in Nigeria, we could possibly have data for about 7,000 participants. And that to me, I think, was maybe an initial driver, in the sense that you're approaching people, you're able to tell them, actually, I'm approaching to join an initiative in which I'm already doing a lot. But it wasn't straightforward. I think it took some time for the initiative to actually take shape. But however, I think by 2021, when we published our first paper on the lesson learned from this journey, I think by then we're covering about what the coverage is about 12 countries in Africa, and IPD data for over 30,000 people. It might look small from the West, but from African perspective, that's very huge. And I don't think someone has done something like that from Africa before. And currently we are sitting with the network of about 15 countries and nearly 60,000 IPD of commitment, and we think it's going to grow further. I mean, why do I think our experience is an equitable one? I think the backbone of its initiative is what I would call an MOU, which is actually a foundation document of this collaboration, and actually outlining to all colleagues joining the collaboration what are the expectations and what are their possible benefits. So from the outset, there's a discussion, there's engagement with colleagues who join the initiative, so that they know exactly that, okay, join this initiative, if our data is used for research, we'll have to get the reward as co-author, for instance. That's clearly outlined. And similarly, they know that they can, we're not taking their data to own, but they can actually possibly use that as a network to also come up with their own research question and answer. That's also been an important driver. And similarly, I think that MOU also clearly show them that their interests are protected. They contribute the data to the collaboration. It's used only for a defined purpose. I cannot be used beyond that purpose, and that doesn't stop them from actually joining other network with the same data. So I think that's been really a catalyst. That's one thing, and in practice it is happening in the sense that it's not only the word on the paper. Is that in practice now they see how things are happening. They see that the publications, if any, they're all invited to contribute. They're all granted that co-authorship, and the few who have eventually approached to eventually use the data for their own purpose, they've got that access. And another tool is actually to be really transparent in the way we communicate. And I think regularly we go back to this colleague. To share with them what is happening within this collaboration. Maybe I should pause at this stage, because it's just an overview, possibly coming to the detail after.
Thank you so much, Andrea Pascal, for that overview, very rich overview. Incidentally, the last Say with Africa session we had, Cindy was here on the panel, and she spoke about the CKD collaborative. And I think one of the things that strike me about the CKD collaborative, CKD Africa collaboration, is what you're saying, ideas happening in what can be described as the global north, with the likes of Professor Mark Woodward, and you are having, a similar idea where you were in South Africa, and this ability to connect and enable, and even pull together people across the region to do something. And you're right, this is the first of its kind, in the African region. And a few things that I really liked from what you said about, having clear expectations and being very clear about interest. There's hardly anything you will go into that you would not have personal or collective interest. And I don't think there's something bad with having interest. They might be enlightened, and sometimes people say they're selfish, but I like to be very clear about, okay, what am I looking for? What's in it for me? I think the problem now becomes when my personal interest now supersedes the collective interest. There should be a way in which one serves the other. Often you will want the personal interest to go with the collective interest. But I like it that you were inviting people to share their interest. How can we protect that interest? Because if there's nothing in it for me, then why am I going to invest in it? But then there was something you mentioned about connecting it back to practice. Often we're being asked about, who are we producing this knowledge for? Are we producing knowledge for people outside, or are we producing knowledge that can be transferred back, and used by stakeholders on the continent? And there's a lot that I would like to ask, about this, but I'll allow you rest for a bit and come back to Julie to talk a little bit about, what are your thoughts about what were the challenges? What were the challenges for you? Because you mentioned how you navigated this learning experience with achieving equity on the 2 projects, and you talked about it being adaptive. It was dynamic. It almost seems like you were learning on the go and tweaking the process. You talked about dialogue. There was conflict management. Maybe you want to talk about the conflict. There was listening, and there are some times that when we do not listen properly. I can tell you that there are some times when I listen and what I hear as one of African ancestry is very, very different from what someone else would hear. But we're all both listening to the same things. So do you want to tell us a bit about some of the challenges you faced in establishing and maintaining these partnerships, and how, what did you do to overcome them?
Yes, sure. Thanks for bringing that up again. I think, listening is very difficult and very different for different people. So as you said, everybody will hear things slightly differently. And I think that's important to acknowledge in any team, but especially in a team that might be, very culturally diverse, geographically spread, so we don't get a chance to be, in person, especially the first couple of years of COVID, we couldn't travel. Nobody was able to leave their own countries, even their own bubbles. So that made things, quite difficult initially, or quite different, let's say, because we had to find different ways of communicating. I mean, for example, this webinar, we probably wouldn't have been able to do like this, or wouldn't have done in this way pre-COVID. So it also opened up opportunities for us to work together in new sort of innovative digital ways, which has its own challenges, of course, but does bring some opportunities as well. So I think it's very important when you're working in any interdisciplinary team, international team, intercultural team, just to be aware that there will be differences, and to make space for those differences. And with those, there also come, power imbalances, hierarchies, and these kind of things that I think need to be managed very carefully. I mean, even if you think about when we work in interdisciplinary ways, so not just talking about international research, but if it's interdisciplinary, there are disciplinary power hierarchies that we need to be, aware of and to manage those. So both of the projects that I mentioned are very interdisciplinary. We have all sorts of what people might call hard sciences, working with the soft sciences, working, of course, with health systems, health policy researchers, and bringing these together in an international context, multidisciplinary, multicultural context, for me is something I find very exciting, but it's not easy, and we have to be aware of these differences and make space for them. So that's kind of, what I was referring to in terms of really listening carefully and adapting and learning as we go. I think having that sort of sense of curiosity that you mentioned, Jacobo, right at the start, and the openness that Andre Pascal also just mentioned in his earlier introduction to his work, which was really very impressive. But having that openness and joining forces, having that mindset, I think for me, it's very much about a mindset of collaboration. And if the mindset is there and open and collaborative, then it doesn't mean that everything else will follow smoothly. I think there's also some very practical things we have to think about, but to me it starts with the mindset, and if you have that open, curious, collaborative you know, a respectful sort of mindset when you enter into partnerships, then that will help to set the scene and to enable the rest of the work to follow on. There will still be, of course, challenges, including resources, you know, unequal distribution of resources. So trying to manage that and balance that out so that you know, so that everybody in the team has the resources that they need to be able to do the work that, you know, that they want to do, and also to be able to grow as an academic and to build their own capacity, I think is really really important as well. So that's where I think some of that really careful leadership and management is really important. But again, I don't just mean leadership from the PI. I actually mean like leadership from the entire team. So I think leadership would run throughout the whole team, and everybody being as accountable for their own work and progress and outputs. And if feeling sort of, or having an environment in which people feel comfortable to ask for things as well, because I think sometimes that can be quite difficult, especially as a junior researcher, or perhaps as a, you know, female researcher, or perhaps as a researcher from a country with, you know, less resources, or historically sort of less, you know, power, then that can be quite, I think, daunting sometimes, or challenging. So being aware of that and making space for that, I think, is really, really important. And as I said at the start, it's not just something you do at the start of the project and then forget about for the rest of the project or the partnership. It has to be something that's ongoing on a regular basis, that's talked about, you know, frequently, and addressed ideally as a team. If, you know, that would be the way that I would do it.
Right. And one criticism, Julie, of some of the grants or funding schemes for global health research has often been the way it situates scholars in countries like the UK as you know, the people who should lead a global health research project, and then others, and the term LMIC is being broadly used to characterize different people. And how have you managed that? Has that been like, do you feel it's been burdensome coming with that sort of arrangement where it feels like the money is flowing from one place to do a particular thing with specifications of the reporting cycles? Has that in any way aided or, you know, hindered your efforts to make your type of global health research equitable?
Yes, thank you for highlighting this. I think it's a really important point. And I think you're right that there has been a lot of that, and that's been a major challenge for many teams. One of the reasons that these two projects came to mind is that we try to do things differently, almost go against that tide if possible. So one of the things I mentioned right from the start is that in the digital diagnostics project, we have two joint leads. So I think having like a joint lead is very, very important, of course. And then also, just to come to the point about the funding. So when we are costing research projects, we have to really make sure that we're costing them, you know, collaboratively, and make sure that the costing, because most of the research is done, most of the work, most of the, you know, research, data collection, analysis, etc., is all done in the partner countries, and so that's where the resources, you know, should be. So I think, I mean, I've led projects where 70% of the grant income, just as you say, passes through the UK Institute, but is actually in the partner organization. And I think that's now funders are seeing that as increasingly important. I think it's been a bit late coming, but you know, I think if you are submitting grants, well, I should hope, and I do sit on a panel, and we've had these discussions where if you're submitting grants as a UK PI, and keeping the money in the UK, but then expecting your partners to do the work, but not get a large share of the funding. Those grants are rightly looked down upon and judged not favorably by the panels these days. I think it might depend on which panel, but certainly the panels that I've sat on, we've had those conversations. And I think, that's obviously a good thing to have those conversations, to really scrutinize, well, where is this money going? And, it shouldn't be staying in the high income UK organizations, but actually should be the work that's being done should be costed in country and properly costed. So I think, it's improving. I think we have a long way to go still. There are some funders now that strongly encourage PIs from, as you say, LMICs. They're all bunched together, which has its own problems, but I think that's perhaps a topic for another tea event series. Yeah, I think there's, it would be the best. I mean, increasingly, I think funders are encouraging, PIs from Africa, from other countries. And one of the things I'm really interested is in South-South collaborations. André Pascal's project, also has many. I mean, I was really impressed that you have many of these South-South collaborations in there as well. And I think that's a really, really important approach where, PIs in southern countries, again, forgive me for bunching all countries together, I don't mean to, but just for the sake of using that term, PIs can lead the projects and then decide also how, have a more, as I said, ownership and leadership and have those more senior roles in terms of PI roles. So I think, yes, there's definitely been a challenge. The way that we have tried to deal with it or to address it is to really have, joint PIs, for example, and even if there is maybe a PI on paper that's from the UK, but the way that we handle it, in reality is to be very shared in terms of decision making and in terms of local ownership of the work. So I mentioned earlier in this project we have 10 PhD students. Actually, we'll soon have an 11th PhD student, and they're really leading the research, on the ground. So having them, but they're supported, of course, by more senior colleagues from different, various countries, supervisors, but they have the ownership and they're really kind of leading that work on the ground. And I think that's really important as well, because it gives PhD students that sense of responsibility, ownership, and helps them to build their own partnerships as well and their own leadership.
Thanks, Julie. Thanks, Julie. A lot of what you described, Julie, seems like ongoing efforts, struggling between what might be described as aspirational and, what is real and possible within a specific context. And André Pascal, if I may come to you next, it would appear that what you did was a lot of hard work. Did you get pushbacks from your colleagues in Africa, in the African countries you collaborated with? Was everybody singing the Kumbaya song and having, well, maybe they weren't, but Julie talked about having a mindset of collaboration, and there's this impression that if I'm talking to my fellow African brother or my fellow African sister, oh yes, we can be collaborative, and maybe that is not what you experience. Do you want to share a bit about the challenges, if there were any, and how you sort of overcame them?
Obviously, I don't want to be disappointing, but I want to think positively by rather starting with the opportunity, because I think I want colleagues to also be encouraged to start such initiatives. because I think we've achieved some success, and it makes sense to, in my view, to share what I think are the driver of such a success. And I think, I mean, one of the driver will have to be that we started this research in an area we master very well. So meaning we're actually able to, I mean, to anticipate on a lot of problems. We didn't anticipate on everything, but at least that strong knowledge of, I mean, of that field already enabled us to be in the position to anticipate on many of the problems. I already mentioned that actually we started with our own contribution. I think having to invite colleagues to contribute to an IPD, having your own IPD to start with, was also a catalyst. Then the third one, and not the least, we should be very thankful to the South African MRC. I don't think we're not fortunate like Julie to, I mean, to have some sort of dedicated funding for this particular project, and we still haven't got so far. But however, being in the position of leadership at the South African MRC, I'm able to, I mean, at my discretion, to dedicate some of the baseline support acts for the unit to support the operation of this particular project. And importantly, at the start, I had a very vibrant junior scientist in the name of Cindy, who was really ready and happy to, I mean, to take this project and run with. So meaning, as the head of the unit, I was able to actually dedicate most of her time to this project, and meaning we didn't require additional support. I think that's how we'll be able to, I mean, to push this to where we are. And not the least is that actually in 2001 we published what I call our experience from after setting up this initiative over the past 3 years, and we're thankful to see and BMJ Global Health for publishing this paper, which I believe has been really catalyst, because we've seen a change in the mindset of colleagues following the publication of that particular paper. I think we are increasingly easily enrolling study as opposed to what was happening before. Now, coming to the potential challenges, I think the first one is going to be financial. Of course, I mean the project is growing. So and the scientists who started this project also growing. So meaning, I think we are facing the need for additional resources for other sources, I mean, to support this initiative. So we've been fortunate recently to through local funding to actually secure a postdoctoral fellow who's going to be assisting and moving this forward for the next 3 to 5 years. So that's sort of partially sorted. There's need some the money to actually turn this data into research. So that's I mean that's the next challenge which we're trying to work upon. Yes, I think that what you wanted to hear about the response of the colleague. I think at this stage it's a bit disappointing, but to say that so far our response rates stand at around 40%. So many of all study potential, I mean, identify possible eligibility for this collaboration. We've so far been able to enroll only about 40%. There are many reasons for which we haven't enrolled the 60% others. One being that for a small for some studies, actually the content you've got on the study is no longer functional. So meaning you struggle really to actually reach out to the colleague to the on of the study. Then for also a large component, they simply don't respond to your request. I think you send email and then Cindy does it on a regular basis, repeating every 6 months. And for many they don't respond. It's actually good to understand that it's only for a tiny proportion that actually we've reached out to and who have completely declined. That proportion it's small, which is actually encouraging. Meaning, even we're able to actually reach out to those who are not responding so far, we could potentially actually increase the response rate. What we also found is that actually I think the face-to-face interaction is far more successful than actually interacting via email. I think meeting colleagues at conference and speaking about this initiative, it's going to secure that buy-in so easily as compared with actually writing email. And I believe in that regard that I think the 2 years of lockdown due to COVID have definitely slowed down. I mean the recruitment into this initiative. I think those are the few points I can share for now. But again, we remain positive. I think we rather sit on the side of what have we done and how can we improve.
And thanks, Andre Pascal. I think it's very important for us to remain positive, and I'll be using your line in my reasoning and thinking going forward. Leonard Vieman asked a very important question, which I like Maggie's response to it. The question Leonard asked was about the roles of African researchers who were born in Africa versus those who have an African heritage but are in other parts of the world. What role do they play in promoting equitable global health research partnerships? And Maggie is also an example of somebody who has an African heritage, lives in the UK, but uses her time, to support colleagues who are in African countries and helping them get access to resources and capacity strengthening. And for me, I was born in Nigeria, but I currently live in Australia. And often I will see my role as amplifying the voices of my colleagues who still live in African countries and supporting, their sense of agency. And so, yeah, I think different people can mention their own experiences. We're short of time, and I wish I could ask you more. But maybe in a minute, I will invite each of you to sort of share what you think is changing. People want to work in an African context and we don't want to use, the same tactics that every other person else has been using. What has changed? What should people be aware of as you're going to work in an African context and you want to stay equitable? And maybe we start with you, Julie.
Thank you. So I think that there are things changing, and I think there's been a lot of great work and thought leadership in this area, and couple of publications have been listed here, and there are many more from our colleagues, really excellent publications on sort of decolonial and post-colonial discourse that really helps, I think, to bring awareness of kind of historical injustices and these power imbalances that I was touching on, in global health research that lead us to where we are today. And I think it's really important, to be aware of those as an academic, regardless of where you're from, if you're, wanting to work in Africa with African colleagues, etc. And, that allows us to really kind of critically examine the partnerships that we're in and to be able to reflect on those. And I think they've also almost sort of helped to create demand for more equitable and more inclusive collaboration. So I think that's a really great thing. And I would encourage people to read those, to familiarize themselves with the literature. But one of the things that I think it has impacted on the research community, but I'm not sure that it's really, because you also talked about communities and stakeholders, and I don't know that that we've managed to really move that from a kind of academic, publications, academic sort of exercise into community awareness and bringing community voices into that discourse. So I think that's somewhere that we still have some room to do, some room and some work to do. But I do think starting off, if somebody's wanting to start off in this area, reading and familiarizing themselves with that literature is really, really important, because I think there's no excuses now for not knowing and not being aware of those historical, and contextual excuse me, important important parts of our history that have brought us to today in global health. So I think that has been changing. One of the things that I was thinking of just now when Andre Pascal was talking about the team in South Africa is that, you know, I've been teaching public health for 10 years with about 120 students a year. So it's a lot of students, and we have a lot of students from various African countries, Nigeria, Kenya, Zambia, Zimbabwe, Ghana, Gambia, etc. They've come to the UK to study, and, you know, these are actually very often, more often than not, highly experienced researchers who have a lot of practical research skills. They just don't have the qualifications. And so, you know, they might be like students, yes, because they've come to study, but actually we can also learn a lot from them. And I've really kind of learned a lot from working with my students who have a lot of experience and helping, you know, and together kind of ensuring that they really make the most of this opportunity to get their qualification and continue with their research and do some really nice publishable work. And that enhances also their opportunities for postgraduate, you know, work. So I think thinking about the strengths that people bring is really important, because a lot of people, you know, have a lot of experience, and really capitalizing on that is really important. And then being familiar, you know, and recognizing the importance of all of this work on decoloniality, I think is somewhere where we're that has been changing, but I just would encourage us to keep going in that area. And I might not have said it, well, I didn't say it earlier, but I'm actually from Eastern Europe. I'm half Eastern European, half British, or half Croatian, half British, and I'm actually working with a colleague on a paper trying to understand this from an Eastern European perspective. So if anybody's interested in that, please feel free to reach out to me. I'd be happy to hear your views. So I'll leave it at that. Thanks.
Thanks, Julie. And we're out of time, but Andre, you still have to put in a final word if you
Yeah, well, I think I'm going to be brief because I think what some of what I'm going to say overlap with what Julia has already said. What's important to acknowledge is that the pool of high caliber research, African researcher based in Africa is increasing. And linked to that is that we're also able now locally to train to the global standard researcher in Africa who have got a different mindset, and very importantly, in my mind, they understand the importance of actually making sure that their interests are secure in any partnership they engage with. Because I believe that it's our responsibility from Africa that each time we engage in collaboration, we make sure that we understand and secure upfront our interests. I mean, once that's understood and people apply it, I think we're going to increasingly be embarking more on some form of equitable collaboration. The missing link, unfortunately, remain the low local funding. I think that's really what is nailing down African, because at times they've got to compromise because they don't have a local source of funding, and having to rely on colleague from the West. They may have to waive their interest to be able to conduct some research. And I hope that in future they'll be found to potentially support the research in Africa from Africa. Then it's got to be in a stronger position to actually engage in more equitable collaboration. I think that will be my final word.
Thank you so much. I mean, such rich nuggets there. I don't have enough time to provide summary highlights, but just enough time to say thank you so much for your time, Julie and Andre Pascal. It's really been a great delight to have you. And thank you everyone who has been with us. If you're interested in engaging further on this, please feel free to reach out. I've provided my email. We'll be providing a post-event blog. So maybe you also want your reflections to be captured. Please send me an email. And Julie has also invited you to collaborate with her on something she's writing on. Please do get in touch. Have a good day. For those of us in Australia, it's evening. So have a good evening. And thank you, everyone.
Thank you so much. Thank you for inviting us.
Thank you so much. And bye-bye.
Bye-bye. Yeah.
Bye.
Bye.